it's Melissa Peters here with DORN Companies, coming to you pain-free live to help you live pain and injury-free. Thank you for tuning in today for another episode of the Injury Prevention Academy, brought to you by DORN Companies, the country's leading wellness-based pain management and injury prevention company, committed to reducing costs of healthcare, workers' compensation, and lost productivity, resulting in over $100 million in savings over the last 20 years for our clients. Joining us today is Matt Marino, who is the Director of Ergonomics and Human Factors at HeroWear and one of the foremost experts in exoskeleton and exosuit implementation, utilization, and adoption in industry. Matt spent the last 12 years as an industrial ergonomist, training, observing, and evaluating workers on safety and ergonomics. And over the last 5 years, he has been heavily involved in bringing occupational exoskeletons into the workplace. He is also one of the founding members of the ASTM Exo Technology Center of Excellence. By his colleagues' estimation, Matt has tried on more exoskeletons than anyone else in the world, and he's fit these devices onto hundreds of real workers. Matt, thank you so much for joining us today. How are you doing this morning?
I'm doing great. Thank you for having me. It's such a pleasure to be on this with you.
Yes, I appreciate your time. And to dive in, the terms exoskeleton, exosuit, what do we mean by those? What's the differentiation between the two? And what are the various types that exist?
Yeah, that's a great way to start this out here. So I'll start out by saying that exoskeletons are not what we see in sci-fi movies like Aliens or Edge of Tomorrow, as much as we might like them to be. Right now, these are devices that augment or assist people. They're wearable devices that people wear and that are used to increase a person's ability to do something. So for our purposes here today, occupational exoskeletons are wearable devices that workers wear to assist them while they're doing various work tasks to get their job done. And there's a variety of different devices out there. There's active devices, which are powered. There's passive devices, which are unpowered. There's devices for the upper body, for the lower body, for the back, for the low back, and for full body. And these devices help workers do things like hold their arms up to perform overhead work tasks or bend and lift objects like we see in logistics or manufacturing industries.
Okay, and the exosuit, how does that differentiate from an exoskeleton?
Yeah, so an exoskeleton is a device that's rigid. So more like a device that has hard components that the person wears, whereas an exosuit is kind of like a soft shell device that fits almost like clothing and is soft. It's made almost entirely of textile type components, and that allows them to be a little bit more lightweight, form-fitting, and a little bit more natural in the way that they move with users.
Understood. So it sounds like at the end of the day, DORN offers a variety of services aimed at reducing pain, preventing injury, promoting wellness. And one of our main goals when we work with anyone is integrating into existing wellness and safety programs. So when it comes to implementing the use of exosuits and exoskeletons, how does this wearable technology integrate with existing ergonomic and injury prevention programs?
I think exoskeletons and exosuits are a new solution for a lot of the common problems that we see in workplaces that we are unable to fix in other ways. So many of us in the community believe that we should stick with the hierarchy of controls when it comes to addressing risk for injury in the workplace. And we do that by first looking to see if we can engineer risk out of the job. And in many cases, this is not possible. There's a variety of reasons why it's not feasible. So we see a need for particularly workers who do overhead work, where it's difficult to engineer that type of posture, that overhead posture out of the job. they can potentially benefit from shoulder assist exoskeletons, because we know shoulder injuries can be really expensive and require a lot of time away from work. There's also back assist exoskeletons for workers who have to bend and lift, and back pain is such a huge problem in the United States and across the world, and a lot of back pain is driven by work demands and the risk for back injury that many people face every day when they go into the workplace and they have to run around a warehouse or a distribution center or a factory or a construction site or a farm to bend and lift stuff. So I see this type of technology as a new tool in the safety and ergonomics professionals toolbox that they can pull when they can't solve a problem in a better way. And I think that these devices fit well into companies' comprehensive ergonomics programs, but they come with their own share of considerations, just like any new technology or bringing any type of solution into the workplace. If we want to put new gloves on workers, we're going to have to do that in a way that helps the workers understand why, that we're trying to help them with it, and where they can perceive the benefits. And then there might need to be a program associated with it to roll it out. So in many ways, exoskeletons and exosuits are not that far off from other types of PPE, like safety glasses, hearing protection, safety shoes, steel toe boots, right, gloves, and things like that, where these solutions are meant to help protect workers and prevent injuries when there's no other way to try to prevent them.
Understood. So correct me if I'm wrong, it's almost just as an exosuit or exoskeleton augments your body's abilities and capabilities, these also augment existing safety programs and ergonomic efforts.
Yeah, you could definitely say that. That's a really nice way to help people understand what these things do, not only for people but for companies. Exactly.
Okay, cool. So you mentioned it's new, pretty cutting edge. Do you have an idea of how widespread the current adoption or use of exoskeletons among companies is?
That is a really good question. I've heard that one estimate that has been put out there is that there's about 25,000 exoskeletons and exosuits in use around the globe. 10,000 of them in particular came from a company in Japan that put out a press release. I believe it was earlier this year that they had surpassed that number as far as sales were concerned. We've also seen European exoskeleton companies talking about having over 500 customers. So we can only assume that some of those customers had multiple devices where others may have only had a few, a handful or less, maybe just one. So I think the estimate of 25,000 exoskeletons around the world is probably a good guess, but one of the things that the exoskeleton industry really needs is a way to track how many of these devices are out there so that people can start to see that that they're not just this brand new sci-fi solution, they're actually something that you can get your hands on and use today. So if I want to know how many toasters there are in the world, I can Google that and somebody keeps track of that number. Right now, nobody's really doing that for exoskeletons and exosuits, and I think that's a need for the industry. But I would say that adoption is still getting there. It's been a little bit slow, and that's been for a number of reasons. But we are seeing now new technologies coming out that work better for people, that people are more willing to accept, and I think there's a lot of potential. Once people get educated on what the technology really is and what it can do for them, I think we'll start to see it take off a little bit more.
And with current circumstances around COVID-19, I know in many ways COVID-19 has been a catalyst for adoption of technological solutions. Has there been an impact or anything that you've come across related to the impact of COVID-19 on the adoption of exoskeletons or exosuits?
I think that some of our essential workers especially those who bend, lift, or work overhead. I think companies may be thinking about these solutions a little bit, but at the same time, we're talking about a wearable technology. And I think wearables come with their own share of fears, right? And fear of the wearable potentially transmitting the virus could be something that companies are thinking about. And that's why some of the smarter companies have ways to make sure that their devices are sanitized and disinfected and decontaminated after each use. And I think that that's not really a problem that we need to fear. But I would say that companies are very focused on the pandemic, and they're doing a lot of things to help address their staff's concerns about it. And things like new technology sometimes fall onto the back burner when that's the case. So while I can't say exactly how COVID has affected the adoption of exoskeletons and exosuits, I honestly don't think it's been helping.
Wow. Okay. So I could see that with the fear of if this is a suit that's going to be worn by multiple people, even if it's its own form of PPE, but perhaps not the PPE of the time. So
Yeah.
building on that idea that maybe there's some fear for around companies, or even the lack of a communication system where companies can learn from experiences of other companies about the use of exosuit and exoskeleton technology, what are some other common barriers to adoption of this technology that you've seen?
That's a great question. I don't know if it's fear as much as it is skepticism. And I do think that there's a lot of misinformation out there about these devices. So, I would say that it's a challenge to try to just get people to understand what is truth about exoskeletons and what is myth. And a lot of us find ourselves doing an awful lot of education, but then once you have a belief in your mind, it's really hard to change those beliefs. So education is a big challenge and is a big barrier to adoption, and it's a bit of an uphill slog, but there are many of us working on that. Another more practical barrier is the fit of the technology. And this is something that I think about a lot and talk about a lot with folks, because over the last 5 years, I have seen time and time again people wearing poorly fit exoskeletons and exosuits. And I've had to help and train everybody from ergonomics and safety professionals to therapists to scientific researchers on how to properly fit the technology. Because if an exoskeleton or an exosuit doesn't fit properly, then it's maybe not going to achieve the benefits that it's designed to achieve. And it could even increase the risk for something else, right? So this is one of those things that while there are always going to be many barriers to adoption of any new technology, the fit of the device is something that we have control over and that we need to take control over. In healthcare, with medical devices like prosthetics and orthotics, the people that fit those technologies on people have licenses and certifications. They've proven their competency. But what we see with exoskeletons and exosuits is people that aren't even trained on how to fit them are trying to fit them on themselves or on other people. And that's something that I think we can do a better job of. There are many producers of these devices that are happy and willing to support their customers with making sure that the devices are properly fit. And I think in time, one of the things that we might start to see is that there are education programs and certifications for fitting different types of exoskeletons. And I think that'll really help. That's a big barrier that we have control over and we can overcome.
Yes, and that actually helps because I want to flip it on its head. And those are the barriers. What, from your perspective, needs to happen to increase adoption, Education is one. What role do certain factors in our society play, like insurance companies or other ways that we can start to increase the adoption of these technology services?
Yeah, certainly education, certainly making sure that the devices are fit properly, um, having the producers provide all of the training and support that are needed to support their products in the workplace would be really helpful. And insurance companies, I think, can definitely play a role. I've seen some really innovative groups looking at exoskeletons and exosuits, taking them to their policyholders, educating those policyholders, helping to arrange pilots. So there are definitely ways that the insurance industry can play a role. They also are keepers of a tremendous amount of data. So if we can start to show that exoskeletons and exosuits have real tangible benefits, that they can help reduce costs, prevent injuries, those are ways that I think insurance can really help to drive the adoption of a technology that can really actually help their bottom line, right? Because if we can reduce injuries, then they'll be paying less. And for the big self-insured companies out there, we can definitely help them save money by preventing injuries or reducing risk for injuries, increasing workers' performance potentially, reducing their fatigue, reducing their strain, potentially reducing turnover. So there's a lot of ways that I think these devices can really benefit both people and companies. But other ways that we can drive adoption would be to start to normalize the technology, show people that there's nothing to be afraid of, and help to make it more of like a household name in a lot of ways. And there's a lot of ways that I think media and marketing and educational groups can help to assist with that too.
Well, hopefully this can be the step towards getting the word out there and the correct information, because I think we all have our own fair share of misinformation in this day and age. I heard you mention some of the ways this benefits companies, and one of them being the bottom line. And at DORN, we're in the business of managing and pain and preventing injury, and we know chronic pain costs employers up to $635 billion annually. We know that overexertion is the number one cause of work-related musculoskeletal disorders. So, what case studies and examples are out there about how exoskeletons have helped to prevent injury and save money to employers?
That's a great question, and unfortunately, there are very few, at least that companies have published and shared. So this comes back to the sharing of information and education. If companies have used the devices and achieved benefits, we haven't always gotten to hear about it, so we don't really know. One good example that I think we can point to, though, is Toyota. They were the first company to make shoulder assist exoskeletons mandatory personal protective equipment for specific processes at specific plants. And they spoke at a conference before COVID hit. It was, I think, the last time we all got together in person was last year's ErgoX conference, and showed some really compelling data that since they've started using the devices in those particular areas, they'd gone from having injuries to having no injuries. And I know that that's not published and it's sort of anecdotal, but this was on a slide that Toyota representatives were speaking about. So I think that's a great example to point to. There are relatively few others. I could talk about personal experiences, but I don't know how deep you want to dive into some of that. And I think it's just too early on at this point to really be able to assign a number, like an ROI, to these devices. There are some longitudinal studies that have been in progress now for almost a couple of years, and they should be wrapping up, and we should see some really interesting results and data, if I had to guess, next year, sometime in 2021.
I'll definitely keep an eye out for that. I'd like to end on, I guess, a positive note, because aside from the bottom line of employers, overall, we know when you can reduce pain, you're also benefiting humans in other ways holistically. So, how can this, in the grand scheme of things, help promote a higher quality of life for people who are able to have access to them?
Yeah, I think about this question a lot too. Many people, when they talk about exoskeletons and exosuits, seem to be talking about preventing the injuries of today, like preventing that acute low back injury where somebody bends over and lifts something and they feel a pop in their back and all of a sudden they get this burning sensation and it shoots down their leg and they can hardly walk, hardly stand up, and certainly can't do their job anymore. Chronic pain is a huge problem. I think the last time I saw statistics about this, it's scary. Something like 50% of people report having some kind of a chronic musculoskeletal disorder or pain of some kind. So I like to think about exoskeletons and exosuits as tools, devices, maybe PPE in some cases that can prevent the injuries of today, but also that if we set people out with them at the beginning of their career, or we put them on them today, they will help prevent the injuries of 10 years from now. Because we know that a lot of these quote unquote acute injuries are really the result of cumulative loading and cumulative trauma that has been building up over time. And it comes from all aspects of life, work included, but these are tissues in the body that are breaking down and reaching a shelf life of sorts. And if we can reduce the strain and the fatigue on those tissues and on those body parts, it will save so much of that person's body and their capacity to do work over time that I think that these devices can definitely help improve quality of life. You know, we'll see people reaching the end of their careers, but instead of having chronic back pain, maybe they won't have chronic back pain. Or we'll see people able to work longer because we know that the workforce, including in the United States, is an aging one, right? So we're having people stick around the workplace for a longer period of time in their life and working into older years. And I think these devices can potentially help extend careers. And instead of people having to quit jobs because they physically can't handle them, these types of devices can help them do jobs with less strain, less fatigue, less discomfort, and not get hurt. Because getting hurt sucks. And if we can keep people from getting hurt, I mean, that's a really simple way to improve their quality of life. They don't have to suffer through that pain. They don't have to be at risk for another injury because previous injuries are the #1 predictor of future injuries. Right. So I think there's a lot of ways that we can improve quality of life today, this week, this month, but also over the course of a person's career.
Well, thank you, Matt, so much for your time and your valuable insight today. We appreciate all of you out there who took the time to tune in and listen or join us and view us today, and hope you gained something out of it, and hope you all tune in for the next episode soon. Thank you, Matt.